I'm Kim Dixon. I'm the health editor here at Politico, and I have the pleasure of introducing a woman who needs no introduction. We at Politico like covering her because she gets involved in health and pharmaceutical policy very often, including just last night. So we'll talk a little bit about that. But here's the Minister of Social Affairs and Health, Maggie De Block, who is going to start with a short presentation.
Yes. Ladies and gentlemen, I would like to give you a very short presentation. Originally, it took us 25 minutes to explain it, but now we will try to do it in 5. So we made a pact for the future for the patient, and I would like to thank Politico for its kind invitation and giving me the opportunity to explain it to you all. A pact for the future of our patients, a pact concluded between our health authorities and the pharmaceutical industry. What are the challenges? We know our healthcare system is facing some important challenges in the future, and authorities, patients, and the pharmaceutical industry each have their own interests. As for our patients, we are facing a growing number of chronically ill and aged people in the coming years. Our healthcare system will have to rise to the occasion, especially where innovative drugs and personalized medicine are concerned. As for the authorities, we put the patient first, of course, and as Minister of Health, I want to give patients and the next generations faster and better access to innovative therapies and personalized medicine. But I too have to take into the account budget limitations, unfortunately. Belgium is at a European summit regarding clinical trials, and also that we want to keep it in the way it is. We want to stay first. As for the pharmaceutical industry, they are also facing important challenges of their own. The ever-rising cost of research and development, the uncertainty regarding to budgets. In order to be able to make good investment plans, the industry needs a stable and predictable budgetary context. So, ladies and gentlemen, it was quite clear to us, doing nothing would lead to nothing. So we chose for the pragmatic route, and we have negotiated for 6 months with the pharmaceutical industry a pact containing agreements for several years to come. Our first chapter of the Pact of the Future concerns the accessibility. One of our main objectives is giving patients better and faster access to medicine. Better access means, in several cases, cheaper. So we lowered the price of drugs, for instance, by asking our doctors and dentists to prescribe the cheapest medicines for our patients. We changed our laws and simplified procedures so as to allow innovation to reach our patients faster, at last 2 months earlier than before. And on a European level, we engaged a dialogue with the other countries to reach a common approach regarding orphan drugs. The first cooperation was set up with the Netherlands and signed in April. The second cooperation was with Luxembourg and was in the month of September. If several countries negotiate together with the pharmaceutical industry on the reimbursement of orphan drugs, they can obtain better conditions for their patients. The second chapter of our Pact for the Future is growth and innovation. In the domain of biotechnology, we have taken measures to ensure that companies can continue to innovate. It is vital that Belgium remains European leader in clinical trials, so we will see to it that we keep our procedure for approval very short, and I mean the shortest, of course. They will be simplified, but the procedures will remain of the highest quality. We'll also examine under what conditions researchers, public or private, can have access to anonymous data on the use of medicines and healthcare. Correct information on the evolution of the number of patients in our country with, for example, diabetes, can stimulate a pharmaceutical company to innovate and to invest in new medicines. Third chapter involves deontology. We know that the pharmaceutical sector is already one of the most regulated sectors worldwide, but in our pact for the future, we go one step further, and we have agreed to focus even more on transparency and clear rules. This means, for instance, that pharmaceutical companies publish all donations to patient organizations. The data concerned by this obligation of transparency will be published on a website, betransparent.be. And then last but not least, we have the fourth chapter of our Pact for the Future. We set a set of agreements on the budgetary frame. The aim is to provide the industry with financial predictability and stability for several years, thus a multi-annual pact, in fact, until 2018 included. We have consolidated existing measures. Competition on the off-patent market is being stimulated. As a result, prices of existing off-patent medicine will decrease for patients and for the authorities. The budget made available this way will be invested in the development of innovative medicines. We also have taken new measures. To name you one, the patent cliff is probably one of the most effective. As soon as drugs become off-patent, the price will drop considerably, we say about 50% and more. We are convinced this will stimulate companies to invest in new products. Now you see, in short, in order to ensure that our patients can continue to benefit from the innovation in drugs and therapy, we concluded this pact, and thus giving the companies who currently in Belgium employ 35,000 people the necessary oxygen to continue and to remain number one in clinical trials. When you see the figures here for 2018, there will be 350 million euros to invest in innovation, 60 million of the patient bills for drugs a year, 226.4 million euros saving for the government, 35 million euros tax reduction for the industry, and 4.7 million euros which we will invest in our administrations to reinforce them. So, ladies, I come to the end of this presentation, and then you see our motto for the next years: we care to change, and we change to care. Thank you very much for your attention.
Thank you for that, Health Minister.
I come to you.
So I think we'll start with the Benelux Pact that you mentioned.
Yes.
You announced that in the summer. What is the latest on that? Have you any concrete progress to report in terms of a negotiation with a drug maker, picking a specific orphan disease, unmet need?
Yes, of course, the pact is not only negotiating together, but also the exchange of data between the countries. We have made a protocol concerning that, sharing registries, and also coordinating assessment methods. So we have first been working, my administrations and the cabinet, with the Netherlands, and then also Luxembourg want to join us after some information and some also talking about how we saw it. And so now we are finally together, starting also to negotiate for the first time with a pharmaceutical company. Well, then we have to be very, there has to be confidence between the partners negotiating, and then you see we cannot give details, but in a few months, at the time due, we don't want to take any risks towards the patients. We say better safe than sorry. That's our lead together, and then we are now negotiating, and then it will be very important once it has been concluded that we can present our result.
Right, I understand the need to be confidential, but if you wanted if there's any other indication you can give us about unmet medical need, are there other companies sort of in the pipeline that you're in early talks with?
Well, we hope to get one result at the start, because it's always difficult to start somewhere. But as I said, for us, for the 3 countries, it is very important that it would be safe for the patient at all times. So that we have to be very carefully, and then we will have our way of negotiating, and that we'll take one after another. If there is interest, of course, in some products, in some techniques also, could be also diagnostics, so then we will see what comes. But I think confidentiality is very important when you are negotiating. It can be done. We have been negotiating for 6 months with all the industry, and there hasn't been one leak. When we made the government, we were negotiating, and it would cost 5 minutes to have a leak to have on Belga. So that's the difference in confidentiality, where it's possible or where it's not possible.
I know that you've said during this process that other countries have expressed interest. Can you give us any update on that?
Well, we have been asked to give information, and that is the first step for several countries. I think Hungarian too, and Austria, yes, and Swiss, I think, no? Denmark, okay, sorry, I'm a bit of my road. But Denmark also has been asking us for information, but we don't want to grow too fast either. We give all the information we can, but for us it would be important to have a first success with Belgium, Netherlands and Luxembourg, and then we can see how we grow. We don't want to grow too fast and not to be able to have any result.
At the EU level, what can the EU? What would you like to see Commissioner Andriukaitis and the EU do to promote more coordination between companies on between countries on pricing?
Yes, well, I think that, as he said, we have to have our own the same goals to for health, that there is a lot of work to do. Unfortunately, we met last year during the Ebola crisis, and there we had really the proof of the pudding was the eating. We had to work together with all member states. We had to act together. We had to coordinate. This was really a good lesson for us, and it was also a good result. We had results. We had solidarity between member states, and we also took our responsibility in that. But I think we could, for example, we could work together, exchange more data. Also, when you see that sometimes there has been an approval by EMA, and then in every member state they have to restart to negotiate for the reimbursement of the drugs. So I think there could be more cooperation between the member states. But then it's always difficult, because, you know, when with Ebola there was really a sense of urgency, and it was seen as very dangerous and very hostile. Now we cannot relax and say here there are a lot of things to do. But I think when I've met the commissioner for several times, that he has lots of energy to invest in that, and that he knows where to start.
Okay.
But, you know, also in Europe, that I mean, I'm Belgian minister, and we also have legislation, administration, but in Europe it takes not months, it sometimes takes years, and that could be changed also. We could reduce the time to get some results, you know, because in health, the techniques are in evolution, pharmaceutical drugs are in evolution, and so sometimes it is a bit too late when we take some measures.
Is there a question or two from the audience?
My name is Emmanuel d'Henricourt. I'm working at the Brussels Parliament. Thank you very much for your presentation. I have two very small questions. About the negotiations you had with the other countries, I take it the priorities in terms of health are different between the Netherlands, Luxembourg and Belgium. So I wanted to know if you had some difficulties in the negotiations about that. This is the first question. Okay, thank you.
No,
That was a very fast answer.
we don't have different interest in getting our orphan drugs to our patients. Our interests are the same, to get the drugs faster to our patients and reimbursed on a reasonable price for the industry, but also a reasonable price for us. So you see, the patient is our first priority for the three countries. The patient, the access to the drugs, but also the safety to getting access to the drugs. So there is no difference.
Okay, very, very reassuring. And the second question, you've been mentioning a few minutes ago that at the European level, sometimes it takes a lot of time. Should we consider your initiative to work with the Netherlands and Luxembourg as a way to criticize the European failure in
No.
this field? No?
That was not. Well, I was asked several times why are we not having more access to orphan drugs, and and then I thought we should, and everyone said yes, we should take care of this problem of orphan drugs on a European level. And then I said, yes, we should. And then I saw that it was they attempted it for several times, and they had no success. Then I thought, why wouldn't we begin with 2 countries, then 3, and then we see how it gets on. And you have to start somewhere, and I will not be for 5 years minister of this country. Well, you never know, I could already have been resigned, but I will not have been for 5 years minister of this country without having even tried to get or working more together. So you see, and that's why I took the initiative to ask. And fortunately, there are 2 smart ministers of health in Netherlands. It's Edith Wissers, and it's only a coincidence that also in Luxembourg, Lydia Musch is also a woman. So maybe it would be easier to get agreement between the women. Yeah.
The women can get things done. Unfortunately, I'm going to have to end it here for our next panel,
Okay.
but thank you so much, Minister, for coming to talk to us.
Okay, thank you.